It's Tuesday, y'all. We survived it. Yes. Awesome. I'm so happy that we're here for part 2 of how to combat nurse burnout. And let me tell you, I've received a lot of feedback regarding part 1 of this series, and I'm so grateful to be able to help you all to combat burnout, because I know it's very difficult, especially in this era that we're living in right now. So let's jump right into part 2 of our series, shall we? Yes. So part 2 is called Workplace and Professional Support. Yeah, I know. We're living in an era where everybody's on their phones and everybody's so secluded, and I don't talk to this person because they are weird, and this person has their own personality and they're all self-centered, or the list goes on and on. But guess what? The reason is because of technology. Everybody's all into their phones. We don't communicate the way that we used to before. We're wired to be able to communicate and feed off each other's energy to keep us going. But because we don't do that anymore, that's why we feel so drained and we feel left out, like something's missing. So one of the ways that we can combat the nurse burnout via workplace and professional support is through building a support system. You work for a company, you work for a team, or you work with a team or a department. You're not the only one in that department, or it's not just the two of you guys in the department. There are so many different nurses in your department or outside of your department. Use them. Make sure that you team up with a colleague, and you have your own assignments, they have their own assignments. Team up together to make those assignments more lively. Give each other moral support, encouragement. If one is lacking some assistance or needs some help, give them that support if you can. And if they can do the same thing for you, I'm sure that they would be able to do that or be willing to do that. Also, normalize speaking about burnout. It's not supposed to be some cliche topic. If you can openly say that I'm feeling drained, I'm feeling some type of way, and your colleague is respectful about it and won't go run to the DON or whoever's in charge and be like, oh, did you hear? She's drained. She's burned out. Da 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 da. Like, we don't need friends like that. But if they can respect you and provide some support for you, that would be the best thing ever. Not saying that you would easily find that, but if you can find somebody in your department or in another department, per se, and you can catch up with each other maybe during lunchtime or a 5-minute break or whatnot, just to, hype each other up for the rest of the day, so you have enough energy for the rest of the day, go ahead and do that, because over time it will help you to stay sane. Because trust me, there will be days, and I'm pretty sure there have been days, maybe it was today, where you're ready to pull the hair out of your head because you had that one patient that kept on ringing the bell. That one patient's parents that kept on asking you questions and kept on nagging you, and you just stepped foot in the room. Your clock just started. Your shift just started, and they're already bombarding you with questions, and you're like, oh my God. Oh my God. Lord help me. Please. All right, so we can start off with that. Secondly, let's use the professional resources that we have, meaning that if we should use the resources provided for, let's say, therapy or other activities that I'm sure that hospitals provide to help our nurses. For some reason, myself included, when I go to work, I just like going to work, do what I gotta do, and leave. I don't want to be sitting here spending my whole day at work, for work, and then stay after work for other activities and staying with people that I'm not too comfortable with or that I really don't want to spend my time with. I understand that. However, if there are activities outside of the hospital that the hospital pays for example, like going to the gym, having a gym membership, or paying for therapy, having a therapist where you can express your emotions freely. And that's not to say that whatever therapist that you get the first time that you stick with them. No, you can always ask for another therapist until you get the person that you feel most comfortable with. So please use all of the resources given to you because they're for you. Most likely they take that out of your paycheck anyway, so you paying for stuff that you don't even use, girl. Make it work. Please. Also, they have something called employee assistance programs, which is basically the same thing. These programs are there specifically to assist with these things. Maybe you don't know about them because they don't talk about them. When you got hired, they give you that big book, or they sent you a whole bunch of emails that you're like, what is this? And all you wanted was a job because you need to pay your bills and you didn't really care about reading all those stuff. So you didn't know about the programs that they offer. Take the time, talk to HR, talk to the higher up nurses that are in your department, and ask them what resources are available for you. And if you don't want to ask, just look it up. I'm pretty sure your hospital has a website catered to nurses specifically that provides resources for you. Or maybe in the group chat that you guys have or whatnot, I'm pretty sure somebody will come up with an idea and say like, oh, did you hear that there's this dance class thing going on the third floor for nurses during lunchtime, or there's this movie night going on the fifth floor next week. Do you want to attend? Something like that. Those things will definitely help you to calm down a little bit and not have to worry about being burnt out. Another thing that you can do is communicate with management. I know, that's scary. I would be afraid to do that too. However, there is a good way and there is a bad way of doing that. The bad way, let's start off with the bad way. The bad way would be like, oh, this is too much work. I can't, too many patients. I'm tired. I'm this, I'm that, and da. Don't do that.
No!
Don't do that. I don't want you losing your job or anything like that, because we all need work right now. It's too much for you to lose your job over stuff like that, when there's a better way of dealing with potential burnout before you get to the burnout. Don't be on your last breath and be like, oh, I can't do it anymore. And then that's when you want to ask for help. We're doing these things for preventative care. But if you're already burnt out, that's another thing. And we're going to be talking about that in the next video. But for now, to communicate with your higher up means that you request the use of your PTO or your FMLA. Please use those to the best of your ability because they're there for that. Especially for your mental health, use your FMLA because that's what it's there for. PTO is there too. It's good too because you're getting paid. However, the FMLA is there specifically for that. You won't get paid, yes, but it's best that you take care of yourself so that you can work more later on or more efficient later on versus not having the energy needed and you're on your last breath and can't do anything anymore. But you're on PTO, meaning that you're still getting paid, but you're still, you only have maybe like two days of PTO versus your FMLA, you're eligible for 12 weeks. Not saying that you need to take all 12 weeks in one row, but maybe you can take a week off this week and then the next 2-3 months you take another 2 weeks until you use up your FMLA for the year. And be rest assured that this is the law. I repeat again, this is the law that ensures you that as an employee, you can return to your position or an equivalent position after using an FMLA. So you should not be worried about losing your job or coming back and they're giving you the runaround and you're so confused and they're so confused and we're all confused. No. I took the time off because I needed to take care of myself. I am back now. Give me my job. Please. And if they can't do that, then you go to the next level. You speak to their higher up. And if the higher up is giving you the runaround, then we have to take it up a notch until you get what you deserve, because that's what the FMLA is there for. All right, guys. So this was some of the advice that I have for today in terms of workplace and professional support. So next time we see each other again, we'll be talking about another topic pertaining to nurse burnout and how to deal with that. So I'll see you on the flip side. Bye.